Hello, my name is Stuart Reynolds. I'm a urologist at Vanderbilt University in Nashville, Tennessee, in the United States. I am pleased to present on behalf of my co-authors our study, Real-Time Daily Assessment of Work Interference on Healthcare Professionals' Restroom Use, a pilot study. It has been proposed that medical practitioners may be predisposed to develop urinary dysfunction, presumably through the adoption of unhealthy bladder behaviors, such as urine holding or delayed voiding, in response to restrictions on toilet access. This has given rise to the concept of the nurse's bladder. However, prior research, including our own, has been limited to cross-sectional studies of medical personnel. And an approach that captures real-time data may overcome some of the prior limitations, including recall bias. Our aim, therefore, was to pilot the feasibility of recording daily work toilet burden, that is, perceptions of limitations at work, and healthcare workers using a cellular text-based survey tool. We hypothesized that healthcare workers who perceived higher occupational interference to restroom use would report fewer daily voids. This is a prospective observational cohort study that uses aspects of ambulatory assessment approach, including ecological momentary assessment. To be included in our sample, subjects had to be adult men and women, full-time employed at our academic medical center, and able to complete the tasks and use a personal cell phone. We recruited 21 healthcare professionals across 4 different occupational settings, including the outpatient clinic, inpatient floor unit, operating room, and MD providers. Our electronic diary used a REDCap survey Twilio integration so that a daily text message was sent to the subject's cell phone via Twilio. This included a link for REDCap's electronic survey. We timed this to target the end of a typical workday, approximately 5 p.m. The electronic diary assessed whether they worked that day or not first, and then if yes, answered questions related to restroom use from the workday, including work interference, which is a scale of 0 to 10 for how much work interfered with restroom use, inconvenience to use restroom at work, again, a scale of 0 to 10, and then the number of voids at work, which is our primary outcome. We also assessed additional urinary symptoms, fluid management, hour worked, numbers of breaks, and bowel movements. Our primary outcome was times voided at work. First, we examined contributors to daily toilet burden in a linear mixed effects model, which allowed us to model the effects within a given day. And then we performed a backward stepwise regression to assess for the presence of the effect of toilet burden among control variables. This table shows some of the sample characteristics. With approximately 5 subjects in each group, these were too few to do individual comparisons across groups. But as you can see, their ages were similar. They were mostly women, but we did include some men. And they typically worked similar workdays in length. 15 out of these 21 participants completed all 14 daily surveys, while 6 completed a median of 12. Over half represented workdays for the respondents. Typical workday ranged between 8 and 12 hours for all groups. And at the end, importantly, 81% reported that completing the survey was easy and that participation in the study did not interfere at all with work. We found that inconvenience on a scale of 0 to 10 was associated with number of voids. Specifically, as you can see in the red box, on univariate analysis, it was close to significance, and then adjusting for other variables, it was significant. And this showed an inverse relationship, so that as the inconvenience increased, the number of voids decreased. We also found that the number of breaks and urgency was associated with increased number of voids per day, while limiting fluids and inconvenience were associated with fewer voids per day. So in this pilot study, we demonstrated that healthcare providers were able to complete a daily text message survey about their restroom use. And provisionally confirming our hypothesis, it showed that increased work burden, defined as increased inconvenience for using the restroom at work, resulted in fewer visits per day. Obviously, this is a small sample size, and so there are limitations related to that. We also didn't compare working to non-working days, and it's unclear how technology may impact participation or completion. But in conclusion, interference with using the restroom at work may result in toileting behaviors and habits that could predispose healthcare workers to develop urinary symptoms and conditions. Further investigation is warranted. Thank you.